The concept of the service is about seeing the right person in the right place at the right time, and what this service has allowed us to do is reduce waiting times for patients. So previously patients were waiting 6 months plus to see a cardiologist. Now that waiting time has come down to around about 10 or 12 weeks. It also allows us to try and direct patients to the most appropriate healthcare professional.
In the past, what would have happened would be that the patients would be referred directly to the hospital. They'd sit on a waiting list for up and beyond 26 weeks. They would then see a consultant, perhaps have a test, and then maybe followed up by the consultants again.
When a referral is received from their GP, it'll be triaged and a decision will be made as to whether or not the patient needs to see a cardiologist, or maybe needs a diagnostic test, or needs to see another healthcare professional. So what it allows us to do is to ensure that cardiologists' times and appointment slots are used for those patients who actually need to see a cardiologist, whereas previously we believe around about 20% of their appointment slots were actually used for patients who didn't actually need to see a cardiologist.
I started developing discomfort from indigestion, and went along to my doctors, ended up being referred to the chest pain clinic, Swansea clinic. There they found that I had angina. That was done very quickly and very efficiently. Found myself then having an angiogram, and from angiogram onto surgery. That was just a period of months by comparison. The result was quadruple bypass surgery. I suspect that from the amount of pain that I had, and from what I've told since, I would probably have ended up with a heart attack and probably damaged heart tissue as a result. So this was early intervention, and it was done at the right time and in the right way.
I had pains across my chest, going up hills and down my arm when walking up hills. I went to see my GP that sent me to see Dr. Truman. Dr. Truman then sent me to have a stress test, and then I had to have an angiogram done up in Bridgend, which I've now found that I have got a thinning of the artery, and I've got to have a stent, which have all been done within a matter of 4 months.
Currently the service operates in Swansea, and the new money that we've received from Welsh Government will allow us to roll out the service now to the Neathport, Talbot and Bridgend areas.
This is reduced waiting times for the patient, it's a better experience for the patient, and actually for the medical staff working in the service, it's a much better experience too, because they're seeing the right people to make a real difference. It's a really good example of what we want to see. Changing the way the NHS works to deliver care that is in its most appropriate place at the right time with the right clinician, and deliver a much better result for the patient. So it's more efficient, but it's really about improving outcomes for the public and also the quality of care that they receive. That's been one of the most encouraging stories about today. The patients are really, really impressed with the care that they receive as they're going through, and how they then can themselves make changes to their life to improve their own healthcare in the future.